हेलो एवरीवन। आज हम बात करेंगे इंटरेस्टिंग टॉपिक ऑफ हाइपरटेंशन रेटिनोपैथी की। हाइपरटेंसिव रेटिनोपैथी एक ऐसी कंडीशन है जो पेशेंट्स में तब डेवलप होती है जिनमें कंसिस्टेंटली हाई ब्लड प्रेशर की शिकायत रहती है। इसके अंदर पेशेंट को बेसिकली जो उनके आइज़ के अंदर का रेटिना होता है, दैट इज़ द प्लेस फ्रॉम वेयर द इमेजेस आर सेंट from the brain to the brain, and that is how one is able to see. And if that starts getting affected, the arteries and the retinal veins, they start getting affected due to the high blood pressure, and due to that the patient starts developing symptoms and problems with vision. Now, what are the factors or the causes that are usually seen that causes hypertensive retinopathy? Now, the factors that will be usually seen are basically high blood pressure, obviously, then persons who have diabetes or chronic diabetes, then persons who are chronic smokers, then those who have a very bad lifestyles or stressful lifestyles, like having lot of fatty foods in their diet, those who have high salt consumptions in their diet, and those who are also taking diet that are low in fresh fruits and vegetables and more high in cholesterol forming diet or foods. Now, these patients or persons who develop this hypertensive retinopathy actually have this problem gradually over the years. Sometimes this may start immediately or suddenly, like the patient may have symptoms like their vision may start getting affected or gets lowered. Secondly, they may have problems with visions. They may have also problem like having high blood pressure, and to that they may have headaches. Then the person may also see halos around the lights, or when they see, their vision may be affected due to that. And they may also have other issues with their eyesight. Now, what are the risk factors that are usually associated with hypertensive retinopathy? Now, the risk factors that are usually seen is obviously those who smoke too much, who are chronic alcoholics, then those who have a diet that is highly rich in salty foods, fats, proteins, and other heavy diets, then those who don't exercise, or those who are having a very sedentary or stressful lifestyle. So these are some of the factors that usually cause it. Then next is then what are the types of this retinal hypertensive retinopathy? Now that there are basically 4 grades that are divided into the depending upon the severity of this condition. तो पहली जो स्टेज आती है वो होती है आपकी ग्रेड 1, जिसके अंदर की जो रेटिनल ब्लड वेसल्स रहती हैं उसमें माइल्ड प्रॉब्लम स्टार्ट होती है, लाइक माइल्ड नैरोइंग हो जाती है रेटिनल वेसल्स की। सेकेंड स्टेज के अंदर जो है रेटिनल वेसल्स की नैरोइंग के साथ आर्टीरियो वेनस निकिंग स्टार्ट हो जाती है, और इसमें ये थोड़ा सीवियर फॉर्म हो जाता है, इसमें एडीमा स्टार्ट होने लग जाता है रेटिनल ब्लड वेसल्स में। थर्ड स्टेज जो है वो बेसिकली तब होती है जब उसके अंदर with the second grade symptoms there also develops retinal edema. There may be cotton wool fluffy spots on the retina, which actually is due to the damage to the retinal nerves. And then there may be other minute aneurysms or bleeding or hemorrhages in the retina. And the fourth stage, which is the most severe form and the most irreversible form, that occurs in which both this third stage is present. Along with that, there is other symptoms of retinal damage and optic nerve damage, which is also known as papilloedema. And along with that papilloedema, there may be some other problems as well in the retinal disc, and the patient may have other issues as well. Now, after this problem, once the diagnosis has been made, we can characterize or know how we can check or see or what treatment can be given to prevent or improve this condition. Now, retinal hypertensive retinopathy, the basic need that needs to be done is to first manage your general management, that is increasing your exercise daily workout, improving your lifestyle changes such as stopping alcohol and smoking should be stopped. Then the patients should have a more healthy lifestyle changes like eating more fresh fruits and vegetables in their diet. Then they should also include some other changes on their diet, like which is also known as the dash diet. And in this, exercising, eating properly, reducing their intake of salt, alcohol, and stopping smoking, all these factors need to be managed. And of course, the hypertension has to be managed with proper medications and other treatments. Now, also, how do we diagnose this condition? Now, there are basically diagnostic specific tests that are done for this condition, in which, of course, we have the use of an ophthalmoscope, which is an instrument that is used to see the eyes retinal and then to see if there is any changes in the retina. Then there is another method or test, that is the fluorescence retinopathy or test, which in which the dye is injected basically into the body, and that dye, when it travels to the retinal arteries or the veins, its pictures are taken, and then we are able to see whether there is occlusion in the eye vessels or the blood vessels. Now, also besides that, there are other treat methods that are used to diagnose or confirm the diagnosis of this condition. The high blood pressure, of course, is a major factor. If a person is having a consistently high blood pressure for a very long time, and they are having symptoms of headaches and chronic headaches, or sudden change in their vision, then definitely we need to look into the causative factors of their lifestyle and what other associated factors they are having, like any underlying conditions of heart disease such as atherosclerosis, sometimes having heart attacks. Patient may have history of that. There may be myocardial infarction, or there may be some other problems with the heart, and that may also a history of stroke, or sometimes chronic history of diabetes or hypertension in the family, and all these factors needs to be considered before diagnosing this condition. Now, what are the homeopathic management for hypertensive retinopathy? Now, there are some good medicines that can tackle the underlying cause of problem. Like, there are some medicines if a patient has a very hectic or stressful lifestyle, and due to that they are having consistent high blood pressure, and then we have medicines that are very good to calm their nerves and lower their blood pressures, and that these medicines are really useful in calming them and improving their general well-being. Also, there are some other medicines that are needed to tackle the underlying medical conditions also, such as if a patient is having any heart issues, any heart disease problems, or they are having some other problems, then those conditions can also be tackled using homeopathic medicines. So this was a small information and video on hypertensive retinopathy. And also we need to know that consider that the patient should be given good diet and eye health, like proper exercise of the eyes, and even some multivitamins that are antioxidant and can improve the vision of the eye can be given, because if the stage reaches the fourth stage, that is the most severe form of retinopathy, that is an irreversible condition and it cannot be rectified with the medicines. And even if surgery is advised in some cases, yet the prognosis is not good, because the patient may suffer eventually and become blind even. So it's very important that the blood pressure is monitored every day in such patients, and efforts should be made to lower the blood pressure, and also to check into their general lifestyle and family and socio-economic status to see if there are any underlying stress factors that are causing this problem. So, and in that case, homeopathy can basically play a very good role that can improve the condition of the eye. So, I hope this informative video uh, gets gives some good help to all those persons or patients that may be suffering from this condition. And in case you like the video, kindly like, subscribe to my channel, and share. Thank you. Have a great day.